often these days. And what's really troublesome is that now we're luring more and more women into the illusion that you can control birth. And what studies have shown over and over again is that once you try to control birth, the more you try to control the process of birth, the more out of control you become. In other words, let's say you try to induce labor. Chances are the induction will fail. Chances are you'll need more medical intervention. You will need things like an epidural for the pain because they're putting a Pitocin drip in there, which creates stronger contractions, thus more pain for the woman. You're going to have you may have medical intervention of using forceps, of using vacuum extraction, and then inevitably you are 250% more likely to have a cesarean section when they try to induce you, like, with putting like an induction type of chemical in you.
Many times the baby isn't even in position; it hasn't even dropped enough.
That's right. That is absolutely correct. And the studies have shown this over and over again. Yet doctors and now more and more women are under this illusion that, the body is biomechanical. Why not? Totally predictable, totally manipulatable. We can do it. We can, a baby can be born at our command.
Or their convenience.
And their convenience, right. And it's just so not the truth.
Because I remember you said in the book, like, someone has to go to a wedding.
Oh, yes.
There's things they want to have they want to have it over before things that they have planned,
Oh, yes. I've heard of a patient. She told me, well, the reason why I had my labor induced was because my sister's wedding is going to be in 2 weeks, and I wanted to be able to fit into the bridesmaid dress. And I just, I'm like, whoa. And the doctor did it. Absolutely. Was in complete agreement. No problem.
They aren't even thinking about the danger to the baby.
Not even thinking. Not only to the baby, but to the mother herself.
Yes.
Again, cesarean sections are major abdominal surgery. Although it is absolutely, and trust me, I am not saying anything negative about cesarean sections, because God knows it saves, mothers and babies' lives.
Sometimes it is necessary.
Absolutely. But when you think about it and that it's done as a purely elective thing, it makes me wonder: do the women know, or the families, do they know of the possible consequences that can come of it? Greater risk of infection, greater risk of complications, less of a chance to bond with your baby because of the pain afterwards. All of these things. I wonder if their physicians are telling them. Are they educated? Do they know of these consequences? Because you're hearing so much of it. So
you
much.
said they were increasing a lot.
Oh, yes. Yes, and it's all this illusion of, hey, no problem. We can, 38 weeks, that's really they consider a full-term baby 38 weeks and up. Well, we hit the 38 week, let's do it.
The baby may have other plans.
Oh, yes, and often the baby does. And the baby's just not ready to be born, and it's so evident in all of those things going wrong. Vacuum extraction is used when the baby can't fall into the birth canal. And so what the doctor has to do, or the practitioner has to do, is basically apply a vacuum to the top of the head and literally pull it out.
Uh-huh.
So you think about that. Or forceps, same thing. They grab this tool that grabs the child's head and wraps around the child's head, and again, they pull the baby out of the birth canal. So tell me, if that's not an indication that the baby's not ready to be born, I don't know what is.
If you let it go the way it's supposed to, it's so much easier.
Yes.
Because I had one of mine without a doctor even. She just decided she was going to come like that.
Yeah, it's so true. But it's.
But too, you also said that sometimes the doctor does it because of his convenience.
Oh, absolutely. Oh, that happens so often.
I know on this show they said I could say anything I want, and I do talk about the different professions. And I just want people to know that they aren't gods anyway.
No, and so many, I hate to say this too, because I'm in the healthcare field, but so many think that they are God, and they perform as though they are, and they, it's an unusual physician that will admit that, that there is something much greater that commands, things that they have no control of. But yes, absolutely, they do this. They do the birth for their convenience. If they'll say, hey, I'm going to be on call this weekend. Why don't we schedule it? Or they try to make it sound appealing to the woman by saying, well, since you can have your husband take a certain day off, and you can have the kids set up with child care, and then we can do the induction. The induction.
Yeah.
Mhm. And that's how they make it sound so alluring.
Maybe if nothing else, will make some of the pregnant women question some of these things.
Yeah, I hope so. Well, I write a lot of in a lot of parenting journals, and I write a lot about the whole phenomenon of controlled birth and inductions and stuff like that. And I'm just basically putting out the facts. I mean, it's just representing all of the statistics and making women know for sure what's going on with their bodies and what are the possible consequences. Mm-hmm. And I think, education, I believe, is a powerful tool. And as long as they know what they're getting themselves into.
Yeah.
Yeah.
They could just say, no, I think I just wait until nature takes its course.
Exactly.
Because one of mine, I kept having false alarms, and I kept going in, and my husband asked the doctor one time, well, when do you think it'll come? And he said, the doctors themselves don't know what causes the labor to begin.
That's right.
And, if you just let it happen, it's all natural, and certain triggers happen, and especially the baby itself has its own trigger whenever it's ready to come.
That's right. The only thing that they know for sure is that the baby initiates its birth.
Uh-huh.
The baby is the one that starts the hormones and everything starting, to bring about its own labor and birth. Uh-huh. It's really not the mom.
And, they always talk about, well, you're overdue, you're going too long. Maybe they just miscalculated in the first place. Nobody knows.
Definitely. Well, if you think about this statistic, there's 7 out of 10 pregnancies come 3 to 10 days after their due date.
Uh-huh.
So think about that. That's a huge percentage that come after the due date, well after, as many as 10 days after. And many practitioners don't go beyond a week. So beyond the 41st week, they're already thinking we have to induce.
Yeah, they keep saying it's going to get too big. It's going to be hard.
Oh, that's another thing. I mean, I've had practitioners go straight to the delivery room, or rather to the operating room, to perform a cesarean for a suspected big baby, and out pops a 6-pounder. I mean, I've seen it all the time.
And they think it's going to be too big, and that's why they want to do it.
Yeah. So they wind up with a little bit of egg on their face.
Well, but I think maybe it will help the mothers to question this anyway and think about it. Just let nature take its course. There's a joke, too. They will come in the middle of the night a lot of times, because wasn't that when they were conceived?
Well, I also talk about the ability to communicate with your unborn baby, and I truly, truly believe in that capacity. And, you can basically talk to your baby and say, it'll be a good time during this time to come. Not that the baby will listen, but, I mean, there is such that possibility to communicate with the baby. The baby's hearing you. The baby feels the loving vibration of or your intention.
Uh-huh.
The baby senses that.
Because in my work, when I've done the hypnosis and they are in the womb, they know everything that's going on.
That's what I'm talking about. So if the mother talks to the baby, or the father, say lovingly, intending for the baby to come at a safe time, maybe, in such and such a time when, not when I'm stuck in traffic and it'll take me 2 hours to get to the hospital. But, there's definitely a way to communicate with your baby. And I think so many of us don't take that time to just sit and attune to the child. There's also a flower essence called Forget-Me-Not. Do you know what flower essences are?
Yes. Well, I do, but I don't know if the listeners do.
Flower essences are basically a tincture of the imprint of a flower captured in an alcohol base. And they were originally developed by a physician called Edward Bach, I believe.
Are they oils, or are they just an essence?
The essence is based in an alcohol solution, and it's a method where they take the flower and they capture its the essence of it, and it's this whole process that they do this, and they capture it in a little bottle in the alcohol base, and the way you use it is you can place it in water and drink it. And it's only a few drops that you would use, or you can place it under your tongue, about 2 drops 4 times a day, or you can, for pregnant women, this is what I advise to my clients, is to place 20 drops in their bath water, and what they do is they stir it with a figure-8 motion, the bath water, and that's basically to awaken its properties, and then you sit in the bath in that bath water for about 20 minutes. And, when you're ready to get out, you just pat yourself dry and take about 10 minutes to attune to your baby. And the essence of Forget-Me-Not is supposed to greatly enhance that ability.
To communicate?
Yes.
That's what you advise using it for, then?
Absolutely, and I write that in the book, to communicate. It also makes you more aware of those timeless soul bonds that you have with your child. So we talked earlier about all of those pacts and those vows and everything. Maybe you can suddenly have an awakening to those pacts.
Because sometimes you also talked about dreams, too.
Oh, absolutely. Dreams is a very powerful thing.
They can have some very prophetic dreams.
Oh, yes. I've heard many women, including myself, having very, very vivid dreams with your soon-to-be child. And, they're very powerful dreams. What I always advise people is to, and I'm sure other people have heard this many times, is to keep a pen and pad next to your bed to capture the dream as soon as you open your eyes. Because if you wait till after you take a shower or whatever, you're not going to remember the dream.
Yeah, that's true.
Yeah, so as soon as you open up your eyes, capture the dream on paper. And, you'd be surprised how, after a year after, not even, maybe 6 months after, you'll take a look at your dream and say, wow, maybe this was a communication with my child, or, maybe this was a little glimpse into who he was or she was before. It could be a very profound experience.
You also said, too, that they communicate with the child before they're born, and then right afterwards, too.
Yes.
Because you can be very close to the child that way.
Absolutely. The way I talk about bonding is a technique